Porcine circovirus belongs to the family Circoviridae and genus Circovirus. They are small, non-enveloped icosahedral viruses containing a single-stranded DNA genome. It was first recognized in 1974. There are three types: porcine circovirus 1, 2, and 3. Porcine circovirus 2 and 3 are both of economic importance as they are pathogenic and result in a number of diseases such as post-weaning multisystemic wasting syndrome and porcine dermatitis nephropathy syndrome.
Let's discuss the epidemiology of the porcine circovirus. Porcine circovirus has been found to be ubiquitous in domestic pigs, and it's found on all 5 continents. Australia at present is considered disease-free, however. With regards to the transmission, it can be transmitted horizontally or vertically. And with regards to horizontal transmission, the oronasal route has been found to be the most important. But it can also be shared in the nasal, tonsillar, and bronchial secretions. Direct contact has been found to be the most important determinant, but pigs can even be infected even when they're kept in separate pens. With regards to vertical transmission, the virus has been shown in piglets after sows were infected, and it can also occur in boar semen, which may result in infections. But evidence regarding whether naturally occurring viral loads have that much of an impact is still to be determined, but wild boars have been found to be reservoirs. So the ages affected are mostly piglets aged between 2 to 4 months of age, and it's during the late nursery to early fattening phase of their production period. So management on the farm will also influence the risk of herds developing PCV. So the housing facilities, whether or not these housing facilities are very close to or very far from each other on the farm, or even the proximity of the farm to other pig farms. The vaccination schedules, especially when it comes to the sows. Hygiene, so good hygiene in the facilities can prevent your piglets from showing signs of post-weaning multisystemic wasting syndrome. And biosecurity is also very important. So whether or not there are shower in and shower out facilities before entering your houses. All of these factors can influence the risk of developing porcine circovirus.
The pathogenesis of porcine circovirus 2 can be quite complex, but it can be easily explained by linking the lesions to the tissues that it prefers to replicate in. The tropism of PCV2 is mainly for monocytic and lymphocytic cells, but it also replicates in endothelial cells and epithelial cells. One of the main consequences of PCV2 is the acquired immunodeficiency that results from infection. This is due to the lymphocytic depletion of lymphoid tissue, which then damages the immune system of the animal. Monocytes and macrophages, which are also active in the immune system response, are also damaged. This also causes lymphohistiocytic inflammation throughout the body. Endothelial cells are affected by causing a vasculitis, which is necrotizing in nature and has associated edema, and epithelial cells are replicated and destroyed, causing widespread inflammation within the body. All of the above results in a severe acquired immunosuppression, mostly due to the lymphoid depletion within the body of these pigs. This results often in concurrent infection with other viruses, also in these patients. Porcine circovirus 2 is known to cause different manifestations of clinical disease within the individual animal. This includes PCV2SD, which is the systemic disease form, the PCV2RD, or reproductive disease form, PCV2SI, the subclinical infection, and most notably, PDNS, which is porcine dermatitis and nephropathy syndrome. All of these have different occurrences and incidences within the pig population, and we'll go into their clinical signs now. PCV2SD is the most widespread form of the disease. Clinical signs affect multiple systems, including the respiratory system, causing dyspnea, the GIT, resulting in diarrhea, as well as other systems like the skin, the liver, and the lymph nodes. PCV2RD was previously known as PCV2-associated reproductive failure, but has since been renamed. It results in clinical signs including abortions, stillbirths, mummification, as well as high pre-weaning mortalities, resulting in huge losses to the farmer. The subclinical form of porcine circovirus 2 is the most common form and also causes a large amount of losses by significantly decreasing the average daily gain of pigs at a farm. The most striking form of porcine circovirus 2 comes in the form of porcine dermatitis and nephropathy syndrome. This is because large, irregular red-purple macules and papules form on the hind limbs and perineum, which sometimes extend forward towards the head. This can very easily resemble African swine fever or classical swine fever, which are both controlled diseases in our country. PDNS also results in severe kidney lesions on postmortem and should definitely be considered as a massive problem at a pig farm.
With porcine circovirus type 2, the systemic disease, you will see enlarged lymph nodes, atrophic thymus, splenic infarcts, an icteric liver, enlarged kidney with diffuse white foci on the cortical surface, and gastric ulceration. With the subclinical disease, there will be no gross lesions, but microscopically you will see lesions similar to the systemic disease. Reproductive disease, you will see in the stillborn and non-viable piglets that there is a chronic passive congestion of the liver and cardiac hypertrophy. Porcine circovirus type 3, which is the porcine dermatitis and nephropathy syndrome, you will see red to dark macules and papules, necrotizing vasculitis that causes hemorrhage and splenic infarcts, and there will be a bilateral enlarged kidneys with petechial hemorrhages.
Diagnosis of porcine circovirus 2 is made using clinical signs, histopathology, and serology. The case definition of PCV2 includes three main diagnostic criteria. These are clinical signs of wasting or illness, presence of characteristic gross lesions, and porcine circovirus 2 DNA or antigen in lymphoid lesions. The herd case definition of porcine circovirus 2 includes two main criteria, being significant increase of mortality in number of run pigs or pigs failing to gain weight or thrive in comparison to previous pigs on the farm, and the fulfillment of three individual criteria which were mentioned in the previous slide. Histopathology. Infected cell cultures can be detected using indirect fluorescent antibody tests or immunoperoxidase staining. Serology. Antibodies against porcine circovirus 2 may be detected by ELISA, which is the most frequently used technique. Viral DNA can be detected using PCR in most tissues or in serum from infected pigs. Real-time PCR has been suggested as potential diagnostic method in live pigs.
Current prevention strategies for porcine circovirus is through vaccination with inactivated vaccines. This is to reduce the virus load in pigs as well as the environment. Current protocols for sows is 2 injections 3 to 4 weeks apart, a minimum of 2 weeks before farrowing, and then subsequent injections 2 weeks before every farrowing. For gilts, 2 injections 3 to 4 weeks apart, a minimum of 2 weeks before mating, and then subsequent injections 2 weeks before farrowing.
There is no treatment for PDNS. Only those epizootic cases with moderate to high morbidity and mortality rates may be important in terms of economic losses. the use of a wide range of antimicrobials has been unsuccessful. This is because the antigen responsible for triggering PDNS is unknown, but no preventative recommendations are indicated. The use of PCV2 vaccines worldwide has significantly reduced occurrence of this condition, emphasizing the putative implication of PCV2 in its pathogenesis.
Past, when farmers wanted to control porcine circovirus, this was before vaccinations were available. They used to give antibiotics to control any concomitant bacterial infections. Now, however, control of porcine circovirus essentially rests upon two pillars. One, which is biosecurity, which essentially means that sanitation is very important, as well as isolation of any pigs that might have become infected with the virus, and also vaccines, of which there are now 4 commercial ones available. One is an inactivated isolate of porcine circovirus 2, which can be used in sows, gilts, and piglets. Then we have 2 different subunit vaccines, which can be used in piglets of 2 to 3 weeks old or older, and then another inactivated recombinant vaccine, which can also be used in piglets of 2 to 3 weeks old